Yeah, so this thing here, that little area right there, that's called an IPK. So we call that an intractable plantar keratoma. Some people call it a porokeratosis or a clogged sweat gland. And what that really is just from, like I was kind of talking about you going barefoot. If you're going barefoot and walking on this, the bones sometimes, so you have these 4 long bones in the foot called the metatarsals, and for you it looks like maybe that 4th metatarsal when you're stepping. The bone is pinching the skin right here, and then the ground is pinching, so it's kind of getting stuck literally between a rock and a hard place, you know. Okay. So big things with these, yeah, it comes back and there's this tiny little core in the center, and it looks like it's like a little hole or crater. Yeah. I'm gonna kind of just skive that out. You know, it's gonna give you a little bit of relief. I'll put a pad on here to take some pressure off. I'll give you a couple pads to play around to try and work with your, like if you take the insert out of your work shoe, you'll notice like, oh, like if I can put this little pad, it's gonna pinch. If I can put this little pad in here, it may and I know, I'm sorry, you're doing so good. You're so strong. Ow, I know, almost done. But that's what it does. It forms like almost like most people say it feels like they're walking on a rock or pebble. Yeah, stuck in their skin. All done? No, just a little bit more. How's that feel?
Feels better.
Does it feel better? I won't torture anymore, but that's kind of like what it looks like after. Kind of just a little crater. If we do nothing and you just keep walking on it, what's going to happen is that pressure is going to build this up again. So lots of times, yeah, we'll take a little pad like this. This obviously, you know, this is temporary. This is not going to relieve the pressure for you for maybe like a day, right? And that's all we do if we can do something like that in a shoe. So if we can take the insert out of your work shoe, and if you are at home walking on something that has a little bit more gush to it, it'll increase the interval of time before this bothers you again. And the last thing we talked about last time was that Flexitol Heel Balm. It's got 25% urea in it. The urea eats away the callus tissue. So between the urea and a pad like this, you can increase the interval of time before it'll bug you again.
Okay.
Okay. Did you get that cream last time?
I know I got